Hi, I'm Amy with Lifelong Recreation, part of Seattle Parks and Recreation. I cover the programming and coordination for 5 community centers in central Seattle. As we're pivoting to online programming, today I'm excited to introduce Megan King with the Washington Poison Control Center, who is hoping to talk to us about, or not who is hoping to, who's going to share some tips on preventing poisoning during COVID-19. Lifelong Recreation has been around since 1970, serving older adults in Seattle. We provide a variety of programming, including exercise, fitness, informational seminars, trips, and a whole lot of other stuff. And right now we're reinventing ourselves due to social distancing requirements.
Thank you for the introduction, Amy. My name is Megan King, and I am a public health education and communications specialist at the Washington Poison Center. Thank you all for tuning in today, and thanks to everyone who is watching the recording of this later on. I realize that we are several months into the COVID-19 pandemic, but this topic of preventing poisoning at home is still very relevant. So I'm excited to dive into all of these topics with you today. I will turn my camera on so you can actually see me. It might cover up some of the slide, so I apologize for that. Hopefully it won't cause you to miss any important information though. All right, let's get started. So this is just a brief overview of what I'm going to cover today. I will start by talking about the Washington Poison Center, who we are, and why I'm here talking to you all today. Then we will dive into the different poison risks during the COVID-19 pandemic. We're going to specifically focus on cleaners and medications. And because this presentation is in partnership with Lifelong Recreation, we are going to call out some information specific to older adults throughout. And then I additionally included a little section for grandparents and poison prevention tips if you have any kiddos around the home. But please keep in mind that even when I'm talking about older adults and information specific to them, all of these poison prevention tips and all of this information is really relevant to every person of every age. We're going to round out the presentation by talking about what to expect when you call the Poison Center. As much as we would love for all poisonings to be prevented, we realize that mistakes happen, accidents happen, so we really want to be sure that you all are comfortable when you are in a situation that you need to call us. So let's get started with the Poison Center. I want to first just get us all on the same page about what a poison is. So we take a very broad definition. To us, any product or any substance can be a poison. It can be poisonous if it's used the wrong way, by the wrong person, or the wrong amount. So obviously that applies to a lot of what you would traditionally consider as a poison, like toxic chemicals and bleach and stuff that's very clearly going to be harmful if someone is exposed to it. But there are a lot of other things that can be included under this definition. Household products, craft supplies, cosmetics, personal care products, those can all be poisonous. Flowers, plants, berries, fumes, vapors, insect bites and stings, snake bites, medications, drugs, alcohol, really anything can be poisonous. And products can be poisonous when they are used in a lot of different ways. So something that might be okay to eat could potentially be poisonous if it is put in the eyes. So I have on the slide all of the different routes of exposure for poison. So there is inhalation, ingestion, so eating or drinking something, eye exposures or skin exposures. So now that we have that just basic definition under our belt, I can clue you in a little bit more on what the Poison Center is. So we are a nonprofit organization that has been preventing and reducing harm here in Washington for over 60 years. So we have a few main services. I've listed two on this slide. There's public health education, which is what I do and what we're here doing today. And then we have our Poison Center telephone helpline, which is probably what most people are familiar with. That telephone helpline is this phone number here. It is a national toll-free number. So you can call this from anywhere in the United States and you will be routed to your local poison center. This helpline is available 24/7 every day of the year, and it is completely free and 100% confidential. If English is not someone's preferred language, we have access to interpretation in over 260 languages. So I have a little bit of data here just so that you can have an understanding of the volume of calls that we receive. I think my video is cutting off the part of the title there, but it says calls to the Washington Poison Center in 2019, so last year. We managed over 125,000 calls regarding more than 66,000 cases. So you'll see that there's a bit of a discrepancy between cases and calls, because a lot of the times we will call people back. Or if it's a more complex case, it might involve multiple discussions with our staff members, so multiple calls. Unsurprisingly, close to half of our calls are about kids younger than 6. We all know that kids like to explore the world with their mouths, so it's really unsurprising that they're getting into things that they shouldn't, so they are one of our primary age groups that we help. But we also receive a lot of calls about teens, adults, and older adults. These calls also tend to be more serious than the calls that we are seeing in younger children. People call us from home, from the workplace, from school, but we also help out medics and EMTs who are either en route to the hospital or are on the scene of a situation. And then we also help out emergency departments and healthcare providers at healthcare facilities who need assistance with more complex cases. Now we can start talking about poisoning during COVID-19. So we clearly receive a lot of different calls about a lot of different substances, considering how broad our definition of a poison is. So this slide just shows some of the main categories of calls that we receive. These are probably our most common ones: unintentional medication errors, accidents with non-pharmaceutical substances, and adverse reactions with drugs, food, and stuff like that. And then we also definitely receive intentional exposures as well. During COVID-19, all of these call categories are common. We're seeing calls come in hitting every single one of these buckets. And why is that? Why are we seeing more poisonings happening, and why is it happening across all of these different categories? The main reason is we are at home more. We might not be able to go to school anymore, or we might not be able to physically go into work anymore. And so we are at home and we are experiencing very different daily routines than what we were previously used to. And this can just cause a lot of disruption in our lives, and it can make us less focused, or can remove some of our memory cues that we might have, and just can lead us to make mistakes easier. We likely also have more poisonous products at home. You know, there's a lot of precautions with transmission of COVID-19, so we might have more cleaning products or hand sanitizer at home. We might have more medications at home because it's possible that we want to limit the amount of times that we're going to a pharmacy or something like that. And because we're at home more, we're around those products a lot more. We're also probably a lot more stressed right now. There is a lot going on in our world currently, and more stress means less focus when we're around these products. There's also just a ton of rumors and misinformation circulating. And that can lead us to try things that we typically wouldn't. So that can definitely lead to accidental or intentional poisonings. We are at the Washington Poison Center seeing an increase in poisoning during this time, specifically with substances that are common to COVID-19 prevention. So we have seen increases in hand sanitizer exposures across all ages, but definitely in younger children. We'll talk more about that later. And we are seeing spikes in poisonings related to household cleaners, bleach, and rubbing alcohol. We are not alone in these trends. Our call trends are paralleling trends across the United States. A lot of other poison centers are also seeing increases in these exact same areas. So now we're going to dive into some of these specific substances to be aware of at this time. So I'll talk a little bit about the risks with those substances, why our risk is increased right now, and then we'll talk through some prevention strategies to make sure accidents with these products don't happen. So we'll start with household chemicals, which is really a broad category. It includes a ton of different substances. I've listed a few here on the slide. So cleaners, disinfectants, detergents, pesticides, fertilizers. There are so many different household chemicals that are out there. These chemicals have always been a top substance we receive calls about, regardless of during this pandemic or not. But during COVID-19, it's likely that we're using some of these products more, like cleaners and disinfectants. They're very important for preventing the spread of the virus, but they can be quite harmful if they are used incorrectly or in the wrong amount. So they meet that definition of a poison very easily. We are seeing an increase in calls about household chemicals because we probably have more products at home. We're using them more often to clean, and we're probably pretty distracted from stress, or if you're a parent and you have kids at home, or grandparent and you're helping out with childcare, that can lead to a lot of distractions. And there's fear of the virus too, which may be leading us to use products in ways that are not intended, that they're not intended to be used. So to prevent poisoning with household chemicals, there are some pretty easy prevention tips that you all can use. First is when you're cleaning, wear gloves and open windows and doors to make sure that there is adequate ventilation, because you can very much have a poison exposure or poison experience from fumes or vapors coming off of one of these household chemicals. Reading and following all directions and safety warnings is very, very important with these chemicals. We receive quite a few calls from people who don't realize, for example, that a product is concentrated and needs to be diluted. Or maybe they do know that it is concentrated and needs to be diluted, but they think that using a stronger formulation of it, not diluting it as much as it should be, might make it more effective. But really, doing so just places you at a much higher risk of having a poison exposure with that product. More concentrated does not mean that it is better or more effective. So it's very important to just follow the directions that are on that product label. We also want you to make sure that you're using products as they are intended to be used. And usually on that label, it's going to tell you what you can use it for, what it is effective for, and what shouldn't be done with it. So, for example, we are receiving calls from people who are using cleaning chemicals or disinfectants on their skin. And this is leading people to have skin reactions or burning because these chemicals aren't meant to be on their skin. And usually on that label, it's going to say not to be used on skin. We're also receiving calls from people who are using chemicals on their masks. They're spraying or soaking their masks in chemicals to disinfect them. And when they're doing that and they put those masks back on, they're having their skin exposed to the chemical and they're also inhaling those fumes. So Please be careful when you're using these products. Make sure that you're only using them as they are intended to be used. Another very important prevention tip is to never mix cleaning products together, because doing so can inadvertently produce some hazardous gases that can make people quite sick. Bleach is one of the big culprits in this, so I have this little graphic here on the slide on things that you should for sure never mix with bleach, which would be vinegar, ammonia, and rubbing alcohol. So know that a lot of the times it's not going to be pure bleach with pure vinegar or pure bleach with pure ammonia that's causing the problem. You need to keep in mind that a lot of products contain bleach or contain ammonia or vinegar or one of these other things. And by mixing those products, you might inadvertently create those gases. So it's really important to check the label of a product. So like a toilet bowl cleaner or a shower cleaner, check to see if it has bleach, which might also be shown as sodium hypochlorite, and check to see if it has ammonia, ammonium hydroxide. And just be very careful in not mixing any of those cleaning products, and also be careful in cleaning areas back to back, because that can also sometimes create those gases if you're using two different cleaning products right in a row. If you're ever unsure about what is safe to use, call the Poison Center and we can walk you through our recommendations for what to do. We also recommend to never use cleaning products on food. We have definitely received calls from people who have used cleaning chemicals and disinfectants on their groceries and on their produce, which has resulted in them ingesting something toxic or inhaling toxic fumes. So the CDC actually came out a few weeks ago, or a couple weeks ago, saying that there is no evidence that COVID-19 is transmitted via food. So really there's no need to use any of these cleaning chemicals on your food products. So our recommendation is to just, when you get home from the grocery store, wash your hands, wash any produce that you've bought with water, and before you eat, wash your hands again. Safe storage is very important with household chemicals. So I have on this slide a Gatorade bottle and a Lysol bottle, and they look pretty much exactly the same. The liquid in them looks pretty much exactly the same. So sometimes people might store leftover cleaning chemicals, say they've diluted something down, they have some left over, they might decide to store it in an empty jar or jug or bottle. And when they do so, it can be really difficult to know if that product is a cleaning product or if it is something safe to drink, like Gatorade. So always store cleaners, household chemicals, and other potentially harmful products in their original containers. And label those containers with some form of very quickly and easily identifiable labeling that shows this is a potentially harmful product. So we at the Poison Center have Mr. Yuck stickers. That's this green guy on the right-hand part of the slide, but it's not necessary to use Mr. Yuck. There are lots of other ways that you can label products. You can use tape, you can color the caps with a Sharpie, lots of different things that you can do. Always store these products up high and out of reach of young children. This is our phone number again, just as a reminder. If you ever have any questions about household chemicals and their safe use, please give us a call. We are very happy to answer questions. It doesn't have to be a poison emergency. If anything, our call center staff tend to prefer getting questions because hopefully that means they will have prevented a poison exposure from happening in the future. So we're going to move on to medications now. So this category actually has two different buckets within it. We're going to talk first about medication errors, but I also have a quick little segment on self-medicating. So let's start first here with medication errors and what I mean by that. So there are a lot of different ways someone can have an error or an accident with their medications. They can take the wrong dose. So for example, they take their morning dose of medications, then they, a couple hours later, an hour later, can't remember if they already took that dose, so they take it again and they end up double dosing. Or it could even be taking 3 pills instead of 2 or something like that. People can make a medication error when they take the wrong medicine. So instead of taking Pepto-Bismol, they accidentally take NyQuil or something like that. The wrong person is another medication error. So someone takes the medicine of another household member or even their pet the wrong time. So someone takes their evening medications in the morning, or the wrong way. Someone accidentally ingests a medicine that it was supposed to be applied to their skin. So there are a lot of different kinds of medication errors. Medication errors have always been a big concern for us at the Poison Center, especially with older adults. There are a lot of reasons why. I've only listed a couple here on this slide. If you're interested in learning more about medication errors in older adults, we actually have a couple more presentations with Lifelong Recreation specifically about this topic. So stay tuned for the end of the presentation. I have those dates listed for when the presentations will be. But so medication errors in older adults, they can stem from a lot of different reasons, but older adults tend to be more prone to them because they are using more medications than most younger people. And they can be experiencing some age-related challenges that make safely and effectively taking medications more challenging, essentially. So like worsening vision or cognitive decline, a lot of different age-related challenges. During COVID-19, there is an added layer of risk. I mentioned this earlier, a lot of us have new daily routines. So this removes any memory cues we might have had about taking medications. For example, say you always took your morning dose of medications as you were grabbing your coffee mug, headed out the door to work or to some sort of activity. Well, now we're all staying at home, those activities aren't happening, so that memory cue of taking your meds as you're grabbing your coffee, it's no longer there. So you might not remember to take your medications, you might unintentionally double dose on those medications if you just aren't sure what has happened in that morning. Stress and distractions are another big one. You might be feeling anxious or stressed right now, and it just leads to less focus when you're taking medication. So it can be really easy to take the wrong medication, to forget if you've taken your meds already, even to take the wrong person's medication, all of those medication errors. And for some of us, especially for older adults, we might not have as much access to support as we used to have. So if an older adult had one of their children come in to help support them with their medications, or had a caregiving service come in to help out with medication management, they might not have that anymore. They might not be able to have people come to them, so they need to be a lot more independent. Managing medications, though, it can be done with some pretty easy and simple strategies. So we'll start with safe medication storage. So just like what I said with those household chemicals, it's really important to keep medications in containers, preferably either their original container or in a pill box of some sort. So leaving medications loose can make it really easy to take the wrong person's medication, or to not really know what amount you're supposed to take if you've already taken it. So keeping them in a container of some sort is very important. Keeping medications separate from those of other household members is also ideal, so that you don't unintentionally take someone else's medication. So that could be keeping medications in entirely different rooms. It could be in different cupboards, lots of different ways you could do that. But if that is not possible, if medications need to be stored together, you can use labeling to make sure that different people's medication is differentiated. So I have on this slide some pill bottles that have different colored bands around them, but it doesn't need to be as fancy as that. I mean, even colored rubber bands would do the trick. One person has only blue rubber bands, the other person has only yellow rubber bands. Or you can use other forms of labeling like coloring the caps or something like that. Always store medications out of sight and out of reach of kids. We'll talk a little bit more about this in our grandparents section. Reading medication labels closely is very important because there can be a lot of issues with double dosing, especially with over-the-counter medications. So I have here, follow the instructions, take the recommended dosage at recommended time increments, but also check the ingredients of specifically over-the-counter medications. It can be very easy to double dose with different over-the-counter meds. We'll use Tylenol or acetaminophen as our example here. So acetaminophen is Tylenol, that brand name, but it's also found in a lot of other over-the-counter medications, like Dayquil. So if someone has a cold, they might have a really bad headache, so they decide to take some Tylenol, but then they want to treat their other cold symptoms as well, so they take some Dayquil, and that means they've unintentionally double dosed on acetaminophen. So it's very important because of that reason to check those ingredients, and if you're ever unsure, just give the poison center a call and we can walk you through what is safe to do. Or if you have inadvertently double dosed, you took Tylenol and you took Dayquil, please give us a call and we can tell you what you need to do and how you can stay safe. Physical tracking systems are also very important and very helpful in making sure medication errors don't occur. So this can take the form of a lot of different things. Medication checklists are one of them. So we have this sample medication calendar on our website, which is available for free download for anyone. It's very simple. You write the medication and its dose in that left-hand column, and once you take it, you just check it off. This method doesn't always work for everyone though, so there are lots of different ways you can work around having a similar checklist. You can use just a paper calendar on your wall, you can use a calendar on your phone, lots of different ways. There are also cell phone apps that are entirely dedicated to medication reminders and physical tracking of taking those medications. This image I have here and the bullet I have on the slide is one app called MediSafe, and it seems to be one of the biggest apps that I have found, or most reviewed apps that I have found. I can't personally vouch for it, and the Poison Center can't vouch for it, but it seems to have a lot of positive reviews. So if you are a tech person or if you use your phone a lot, this might be a good way to keep track of those medications. You can also use pill organizers. So these can vary a lot in levels of support and in format as well. So pill organizers could be from your pharmacy, where you can ask them to bubble wrap your different doses. So they'll send you in just little packages your dose for that day. Or you can have pill boxes, so simple pill boxes like this. But then there are some that offer a lot more support, like the MediSet, which actually will have flashing lights and audio cues and telephone calls if you haven't taken your medications. So again, we have a lot more resources on our website about all of this. I encourage you to go there and check those out, or to listen in on one of our upcoming presentations that's all about medication management. Using a medication list is very important for knowing what you are taking and making sure you're taking the right amount and taking it correctly. So a good medication list will include every prescription and over-the-counter medication you take, regularly vitamins, supplements, and any other substances that you regularly use. And for each substance, it needs to include the name, its dose, why you take it, the time of day you take it, and any other special instructions for that. So again, we have some sample resources on our website. This is a medication list worksheet that you can use. So in our medication list format, it's one worksheet per medication so that if your medication plan changes, you don't have to rewrite your entire list. You just toss out the page that had that specific medication on it and do a new one for it. If you have any questions about how to develop a medication list, we also have a development guide posted on our website that walks you through everything you would need to include, all of the information that's important. Getting rid of any unneeded, expired, or unwanted medications is also a very important strategy to prevent both accidental use of the wrong medication as well as intentional use of medications by other people that shouldn't be taking them. So we have a website here in Washington that the Poison Center runs, and it's called Take Back Your Meds. And it has a map feature as well as a list feature where you can look up all of the free medication disposal or secure medication return sites in your area. So Seattle has a ton. If you were to zoom in, you would see even more of these. All of these, it's free to take your medications back to. They're all secure. Some of them are in pharmacies, some of them are in police stations. You can use this website to find those, and it'll also tell you if there are any restrictions on what that site can accept. Obviously, COVID-19 makes medication disposal a little bit more challenging because you might not want to actually go to a location right now. So our recommendation is to take back medications if you're already going to be going to that site. So if you're already headed to the pharmacy to pick up a new prescription or whatever, then take back your meds if you're already going to be there. Otherwise, there's no need to make unnecessary additional trips. Just safely store your medications at home until it is safe to go and return them. So store those meds up and away, or if possible, lock them up. Finally, we recommend adding labeling to look-alike substances. So I have some examples of look-alikes here on this slide. We receive a lot of calls about people who have made accidents with, or who have had accidents with look-alike substances. So a good one is anything that looks like eye drops. So we've had calls about people who have accidentally used glue thinking it was their eye drops, or they've put eardrops in their eyes, or lots of other different things. So it can be really easy to make these mistakes. So though it's a good idea to add labeling, use markers, stickers like Mr. Yuck, tape, or any other types of labels to distinguish between those lookalikes. Once again, here's our phone number. If you ever experience a medication error or have any questions about medications, please give us a call. Our telephone helpline is staffed by nurses and pharmacists, so they are extremely knowledgeable about medications and are able to help you with any question or any emergency you might have. So self-medicating is our other bucket under medications. There's been a lot of rumors circulating and a lot of misinformation circulating about different medications, vitamins, supplements, and lots of other substances that are helpful in preventing or treating COVID. Right now, though, there are currently no approved medications, vaccines, supplements, vitamins, or any other substance to prevent or to treat COVID-19. So be very wary of any products that claim to do so, especially since some of those products could lead to some pretty harmful or even life-threatening side effects. They could interact with other medications. There's a lot of things that could happen by taking or adding on these other medications or products into your normal routine. So before you try something new, talk to your doctor or pharmacist or call us, and we can walk through, what you're already taking and what is safe for your health and your body. Never use disinfectants like bleach or other non-pharmaceutical substances in ways that they aren't intended. That can be extremely harmful to ingest bleach or other non-pharmaceutical substances. So please give us a call if you are unsure if something is safe. In addition to self-medicating to treat and prevent COVID-19, we're also seeing some intentional use as coping mechanisms or stemming from anxiety and stress and depression during this time. So intentional use, it's always been a concern for us at the Poison Center. I have some 2019 data up here on the slide. But COVID-19 has really increased isolation, it's increased stress, and this in turn for some people might increase substance use, self-harm, and thoughts or attempts with suicide. So we have this heartbreaking statistic here that we've actually seen a 10% increase in suspected suicide cases during COVID-19. I do caution some I would interpret this statistic with caution though, because typically our data mirrors nationwide trends, and this is not actually a trend that's being seen across the US right now. So there might just be something going on with our data here. It's also a very short time period that we looked at, just the beginning of January through the end of April. So we're going to stay tuned, keep looking at this data a little bit more to see really what is going on. So our prevention strategies for intentional use are to take breaks from the news. We're just constantly being flooded, inundated with so much information, and it can really add to our stress levels a lot. So it's a good idea to just take a step away sometimes, take breaks. There's no need to be connected all of the time. Setting up regular communication is very important as well, because we live in a very uncertain time right now. Things are rapidly changing. We don't know what the future is going to look like. So it can be very helpful to know that you have something regular and something certain set up that you can look forward to and can engage in. We encourage folks to also reconnect with organizations or social connections that were important to them prior to the COVID-19 pandemic from happening. A lot of organizations now have figured out ways to re-engage their communities, like churches and libraries and programs like lifelong recreation. Everyone is trying to figure out new ways to stay connected during this time. So we encourage you to reach out to any of those communities and organizations that were important to you beforehand. There are also a lot of virtual resources you can check out that can provide some tips for you to do at home. If you or a loved one is thinking of suicide, you can call the National Suicide Prevention Lifeline and talk to someone. If there is any case of self-harm, please call 911 immediately for help. All right, so we're going to talk a little bit about poison prevention with kids. This is our grandparents section, but again, it is applicable to anyone who might have children at home or visiting their home. So the first substance we want to talk about here is hand sanitizer. We have seen a over 50% increase in hand sanitizer exposures during this pandemic in children younger than 12, so in little kiddos. What is concerning about hand sanitizer is that it has very high alcohol content. A lot of times it's up to about 60% alcohol. So that is a lot stronger than wine, than beer, and than most hard liquors that you would have in your home. And so when a child gets into hand sanitizer, so if they lick their hands after it's applied, or if they get it in their eyes, or if they even take a drink out of the bottle, it can really put them at risk of consuming a high alcohol content, or it can put them essentially at risk of alcohol poisoning. So that's why it's really important to safely use and safely store hand sanitizer when there are kids around. Always supervise kids when they're using hand sanitizer. Give them just a very small amount. So we say about a dime-sized amount, and have them rub their hands together until they're completely dry. Once you're done using that hand sanitizer, keep those bottles out of sight and out of reach. We actually get quite a few calls about the hand sanitizers that are just on the little like keychains, because they're so easily accessible, and they're usually just right in sight because they're right on your backpack or they're right on your purse or something like that. So it's very important to remove those, keep them out of sight and out of reach when there are kids around. If a child is exposed to hand sanitizer, call us immediately. Do not wait for any symptoms to start. Specifically with medications, there are some more tips when there are kids around. If you take medications, take them out of sight of children. Kids love to mimic the adults in their lives, and so you wouldn't want them to watch you taking your medication and then them wanting to pretend like they're like grandma or like their parent, and they go and end up taking that medication as well, so that they mimic your behavior. Always check carpet and floors for dropped medication. That's what this image on the slide shows. A lot of medications look really, really similar to candy, and it can be virtually impossible to tell the difference between the two, especially if you're a little kid. So make sure you're checking around to see that there's nothing on the floor. It's also important to call medication what it is. It is medicine or a medication. It is not candy. Some people might say it's time to, it tastes just like candy. They might try to entice kids to take medication by calling it candy or something sweet or something yummy. But that could be harmful because it might mean that kids that have a sweet tooth decide that they want to have some more of that candy, so they take the medication. When you are giving medicine to a child, always use the dosing cup or syringe if it is a liquid medication. Some people use just common kitchen spoons, and that can actually lead to medication errors, like giving the wrong dose, because kitchen spoons are all different sizes, and so you're not going to be able to provide an accurate dose to the child. All right, so now we are on to our very last section on what to expect when calling the Poison Center. So as I said earlier, as much as we hope that we can prevent all poisonings from happening, that's not always going to be the case. It's very easy to have an accident, to make a mistake, so we want to be sure that you know when to call us and how to call us, and that you're comfortable in doing so. So if you have any questions or emergencies with potential poisons, give us a call. It does not have to be an emergency. Again, please just call if you have a question about something, because we would love to help you and make sure we prevent a poisoning from happening in the future. You can call about yourself, or you can call about other people. It doesn't matter. You can call about a stranger if you want. We are willing to help in any way that we can. We are still open during the COVID-19 pandemic. Our hours have not changed. We will always be available around the clock every day of the year, even on holidays, doesn't matter, 24/7, 365. We also right now encourage people to call us first, unless someone is having very extreme symptoms, like they're unable to breathe or they're unconscious. Give us a call, because that way we can hopefully keep you out of the emergency room, or keep that person out of the emergency room. We can save you money, and we can prevent any further exposure possibilities for you to COVID-19. So you know when to call us. Now, this is what to expect when you do call. You're going to talk to a poison expert. So our call center staff are all specialists in poison information. So they're expert level nurses, pharmacists, and poison information providers that have gone through a ton of training on all sorts of toxicology topics. So they are very knowledgeable. A lot of them have been at our call center for a very long time too. We average about 13 years. So they might not have heard it all, but they've heard a lot and they know how to help you. If they ever need any additional assistance, our spies can call upon our on-call board certified medical toxicologists. So these are MDs who have specialized in toxicology, and they're available to provide our spies with more assistance, or if a healthcare facility calls us with a really complex case, they can provide assistance in that as well. So when you talk to one of our spies, they're going to guide you through a series of questions about what happened. So what was taken? How long ago did it happen? How much was taken? How are you or how is that person feeling? It's totally fine if you don't know all of this information. We just want to gather as much as we can so that we can help you to the best of our ability. Then we're going to tell you what you need to do. We'll tell you if you can stay home or if you need to go to the emergency room. So if you can stay home, we're going to tell you exactly what you need to do and what you need to watch for. Most of the time, this is what we can do. We can keep you home. When we actually looked at our data during this pandemic, so folks who were exposed to cleaning products, bleach, rubbing alcohol, we kept over 80% of them at home. We were able to treat them there. They didn't have to go to the emergency room. But sometimes you do need to go to the emergency room, and we will tell you that. We'll also tell you if you can drive yourself or if you need to call for an ambulance to take you there. And then we will oftentimes call you back later. We just want to make sure that everything is all right, so we will check in. You can ask us more questions then, or you could even call us back as well and ask more. One more time, this is our phone number. Remember, we're available 24/7 every day of the year. We're completely free. We're never going to ask for your insurance information. We're confidential, and we have access to interpretation in over 260 languages. So really, anyone can call us. So thank you all today for joining us live or watching the recording. This is my contact information up on the slide, as well as our website, wapc.org. Lifelong Recreation, these are some of their links, so their website and their Facebook page. So I encourage you to go check them out, see what other programs they're offering during this time. As I mentioned earlier, we have some upcoming presentations with Lifelong Recreation, so I will be giving both of these as well. So in July, we're going to have a presentation on medication management for older adults, and it'll go through in a lot more detail different medication errors, how they happen, why they happen, and ways to prevent them. Then in August, we have a training that is for caregivers of older adults on medication management. And that training will walk you through assessing an older adult's ability to manage their medications and working with them to implement some potentially improved strategies to prevent any medication errors from happening. So I'll just put my contact information back on this slide. Please email me or give me a call if you have any questions. Otherwise, thank you so much, everyone, and I hope you all stay safe and well during this time.